This episode is brought to you by Progressive Insurance. Fiscally responsible, financial geniuses, monetary magicians. These are things people say about drivers who switch their car insurance to Progressive and save hundreds. Visit Progressive.com to see if you could save. Progressive Casualty Insurance Company and Affiliates. Potential savings will vary, not available in all states or situations.
This episode is brought to you by Merrick Pet Care. For over 30 years, Merrick has crafted high-quality dog food. Since our founding in Hereford, Texas, we prioritized whole nutrition, with deboned meat, fish, or poultry as the #1 ingredient in every dry dog food recipe. That's why we say real is our recipe. Real ingredients and home-style flavors your pet loves, all to fuel more real time together. Look for Merrick online or in your local pet store.
This episode is brought to you by Indeed. We're driven by the search for better, but when it comes to hiring, the best way to search for a candidate isn't to search at all. Don't search, match with Indeed. Use Indeed for scheduling, screening, and messaging so you can connect with candidates faster. Listeners of this show will get a $75 sponsored job credit to get your jobs more visibility at Indeed.com/SBO. Terms and conditions apply.
Which baseball player has the shortest commute? The catcher. He only works from home. Why did the dandelion quit dating? It kept getting blown off.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve, take a cow for
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve, and my little pal, Dr. Scott, the traditional Chinese medical practitioner, gives me street cred, the wacko alternative medicine jack-offs. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who would never listen to a medical show on the radio or the internet. If you've got a question you're embarrassed to take to your regular medical provider, can't find an answer anywhere else, give us a call at 347-766-4323. That's 347. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, respiratory therapist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. I lapsed into my radio voice there for a second.
You did, didn't you?
I certainly did. So check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. We'll talk about it in a second. And then, I guess we're still live at stuff.drsteve.com. So if you need anything from Amazon, please go there. Use that link. You can scroll down and see stuff that we've talked about on the show, or you can simply click through and go straight to Amazon. But anyway, check that out at stuff.drsteve.com. And apparently we're still active with Noom as well. So if you got that COVID weight, we're getting rid of Omicron, want to get it off, go to Noom, shef.drsteve.com, and you'll get 2 weeks free and 20% off if you decide to do it. And it's only a 3-month program, so it's not like some of those other ones that rhyme with flotchers where you have to do it for the rest of your life. Anyway, check out our Patreon. You're not going to want to miss Patreon this month. We had Robert Kelly on. He'll be on the one in a few days, in about a week from when we're recording this, which is on the 16th. And then we have a mystery guest who was supposed to be on the one that we published this week, and I don't want to say any more. He is revealed in the Robert Kelly episode.
Cool.
The mystery guest.
Mystery guest.
Okay. Anyway, and it's not Cardiff Electric. And although we'll have him on someday. We got to get the boss on someday. Check out chef.drsteve.com. You got to spell out doctor on this one. I haven't gotten to the other domain yet. This is my favorite meal kit so far that I've tried. I've tried them all.
Yeah.
I did Blue Apron.
Yep. Loved it.
Loved it.
Yep.
Did Tara's Kitchen. That's the one I liked it. It was crazy, though. They would send you everything already chopped up. Like Blue Apron will give you, like if it calls for 2 radishes, you get 2 radishes, right? But with Tara's Kitchen, if it says it's 2 radishes diced up, you got 2 diced up radishes. They had these little trays that had they sent it to you in this big giant, it looked like a little mini dorm fridge. You'd open it up and pull out these little trays, and so everything was already prepped. It was all mise en place. That's what they should have called it.
Yes,
That's what they should have called it. They would have done better. But I think that one's out of business. It was a crazy business model. But I like this one. It's Green Chef. It's healthy, organic, if that means anything to you, keto, gluten-free, whatever you want. They have anything you want. And you can go vegan if you want. I've tried all of these. This is by far the highest quality of the ingredients that they sent.
Wow.
The last one I did, I think, was HelloFresh, and I'm not crapping on them, but there were some issues with every time there'd be something missing, or, some of the stuff like freezer burned or whatever. Nothing like that with this. These people know how to pack it right. It's packed perfectly in there. I love the way they do it. It comes in recyclable bags, and the perishable stuff is at the top, and then the meat is down below that under another layer, and then there's the ice pack. So everything, the meat comes, if it's supposed to be frozen, it's frozen. All of the vegetables come, they're fresh. It's great. It's by far the best to me so far that I've found. So you get $130 off your first order with the best meal prep kit on earth, I think, Green Chef. Go to chef.drsteve.com and spell out doctor, and I'll put it on our website too.
Okay.
All right? That's a good one. All right. Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And how's the CBD-laced nasal spray going?
So far, so good.
It's just CBD, though, right?
Yes. There's no goodness in it. There's no adult form of it.
Does anyone? Oh, so this is for kids? Is that what you're saying? I don't think so.
I'm not saying that at all.
I don't think that's what you meant to say. Is anyone making a nasal spray that has THC in it?
I would think so.
I went to a dispensary in Chicago, and I did not see anything of the sort. They had tons of gummies, and they had some stuff that you could inhale, but I didn't see any nasal inhalers.
I've not seen it, but
why wouldn't you?
Almost has to be, because I've seen it. I've seen them make the granules that you dissolve in powder. I've seen
granules you dissolve in powder. What the hell is that?
I'm sorry, powders. The granules like in a powder form that you dissolve in your drink.
And then just drink it.
It's just plain THC.
That's stupid.
I've seen inhale making it in little coffee pot. Like you can put in your Keurigs and all that stuff.
Really?
For real, yeah. For real. It's
that's hilarious.
Yeah.
Okay, here we go.
Any possible way to get you some weed in you.
This is from Vice.com. Says you can now snort weed using this cannabis nasal spray if that's something you wanted to do. So when listing off drugs you can snort up your nose, marijuana usually doesn't make the list, but with cannabinoid spiked nasal sprays, like Dr. Scott's, CBD is a cannabinoid. That's now possible. Then when it comes to how high it gets you, sniffing may not be any different than smoking. Well, yeah, no shit. It's just a different delivery route.
Yep.
says homemade cannabis nasal sprays have existed on the fringes of medical weed market for years now, but a Colorado company recently released a commercial version. Look this one up, Dr. Scott.
Yeah.
Vera, Verra, Wellness, Nasals Mist. Comes in 3 ratios, 10-to-1 THC to CBD, 1-to-1, and 1-to-100. That's probably more like what yours is.
Yeah, except for mine's a zero.
Well, it's supposed to be zero, but it could be as high. I mean, if it's extracted where they got the CBD from, it could be as high as 0.3% and still be legal. Mm-hmm. According to the company's marketing material, spraying the mist up your nose allows for increased bioavailability. Okay, now wait a minute now. Not so sure about that. What they mean, though, I think, is that there may be more surface area. Well, that's not even true. Yeah,
that's less true.
That's less true.
If you think about the surface area of the lungs,
yes, of course,
and
that's why inhaled drugs are going to be the thing of the future. Anyway, let's talk about that for a second. Look up. Forget about Vera Wellness. Look up surface area of the alveoli of the lung, and it will blow your mind. When you breathe in, air goes down the trachea, and then it splits into 2 major bronchial tubes, and then it splits again and divides until it is just microscopic air sacs that are lined with capillaries. Mm-hmm. And when you breathe in, the oxygen that you take in from the outside is very efficiently transferred to the inside of your body because of the huge surface area. What does it say?
1,076.4 square feet.
That's less than I thought it would be.
That's still pretty big, though.
It's still pretty damn big.
That's pretty big.
How big is that compared to, say, a football field? So a football field is
look.
X yards by X yards, so we can just multiply that out. I mean, it's 100 yards by how wide is it? Why do I not know that? Oh, for fuck's sake. Dimensions of a football field.
Here, and I've got it's 57,000 square feet. But if you think about it,
there you go.
Yeah.
Okay. So that's 57,000 square feet. So it's 1/50th approximately,
which is huge.
Yeah,
huge
in your lungs.
Yep.
So what we're saying is, if you somehow could go in and tease all those out and stretch them out, that would be a how much? What was it? It'd be 100 feet by 10 feet, right? Did you say 1,000 square feet?
Yeah, almost 1,100.
Yeah, so it'd be 100 feet by long by 10 feet wide if you could stretch all those things out and lay them on a piece of paper or something. So it's amazing. And when you, for example, if you take in nebulized drug X, and assuming that it is, that it can be transported across the mucous membrane, go ahead.
Well, I've got something interesting to share with you before you get much further than this.
Yeah.
A basketball court I looked up.
Okay.
Square foot of basketball court, 4,700 square feet.
Okay, so it's a fourth of a basketball court. That's a little easier to visualize than a 50th.
That's incredible, though, if you think about that.
Yeah,
that's incredible.
Wild.
Yeah.
Okay. So it'd be half. You go up to the midline and then cut that in half, and that's the surface area of your lungs. Now, so we did some research early on inhaled morphine. Now, if you put morphine in a nebulizer, one of those things that makes the steam, or it's not steam, it's just nebulized liquid, and you inhale it, it's around a 10% bioavailability. In other words, if you put 10 milligrams in there, it's like giving you 1 milligram IV.
Okay.
But that's because if you've ever seen somebody do one of those, most of the medicine goes out into the room.
Yep.
They're breathing in and then they breathe out, and there's just smoke everywhere. So if you can figure out a device, and they have done this, where you only get medicine when you inhale.
Okay.
And you get all of it. None of it goes out into the room.
Okay.
It's almost 100% bioavailable. And the cool thing is that doing it that way, it actually gets into the system faster than if you do it by IV.
Wow, yeah.
Isn't that crazy?
Yeah, it makes
because
sense.
of the surface area of the lungs.
Area, yeah.
So if I give you something intravenously, in usually in your arm or your hand, it has to use the venous blood flow, which isn't real fast, to work its way up the arm into the shoulder, into the larger blood supply, into the right side of the heart, and then go through the lungs and then come back and then get pumped out of the left side of the heart to the rest of the body. Whereas if you do it with the inhaled system, it goes right to the lungs, gets pulled straight out of there, goes straight to the heart, and gets pumped to the rest of the body. And if you look at the curves, it's weird. You'd think IV would be the fastest thing possible. Mm-hmm. If you look at the curves, the inhaled morphine will have a more rapid peak than the IV morphine. So it's kind of cool.
That is cool. And
morphine's water soluble.
Yeah,
it's not even that soluble across mucous membranes. Go ahead.
Yeah, I was thinking, Dr. Steve, is that kind of the way the IV medications work pretty quickly? Is because they're filtered in through the lungs, and that's where it's broken down.
IV?
Once it goes into the blood vessels. It pumps through the heart, goes into the lungs. At that point, it's starting to dissolve.
Well, that actually slows it down.
Okay.
If you think about it, because now it's got to divide
right.
all these places, and then reconstitute itself into larger and larger vessels before it gets to the heart,
right,
to the left side of the heart, and then the left side of the heart is what pumps it to the brain and then everywhere else.
Yeah.
So it really, the lungs sort of. Is a rate-limiting step in a way.
Okay, interesting. Yeah.
Although it's not much, but there is some delay there.
Yeah.
So that's it's interesting.
That's pretty well.
Anyway, I had another point to make on that, but so that's why. And then the GI tract is slower than Christmas compared to both of these things, which is why if you eat a gummy or whatever, people get in trouble with those things because they'll eat one and then 30 minutes later they don't feel anything and they'll eat another one and then 15 minutes later they'll eat another one and then by an hour and a half they're just totally faced.
Just done.
Yeah.
Done.
So follow the directions, my friends. All right.
That's beautiful.
You got anything for us today? I know that by looking at covid.stoutlabs.com, the Omicron peak is long past. And we predicted if that peak is symmetrical, that Omicron started around, if you look at go to covid.stoutlabs, stoutlabs.com, and just put in the United States and go to like 700 days. And you can see all the different curves. And you can see all of them are pretty symmetrical. And so Omicron really started right around Thanksgiving. So if you look at it, November 25th, you just pick a starting date in there. And then count how many days it took for it to peak, which was basically 30 days. And then look how far it's going to be or was it 30 days or 60 days? God damn it. Now I'm... let me see.
Dementia's kicking in.
Yeah, a little bit. Stout, because that doesn't sound right.
No.
Let me look at it and see here. Maybe it was Christmas when it started. So I'm pulling up covid.stoutlabs.com, and I'm looking at. Yeah, I'm sorry. So it started around Christmas. So let's just say it started. That the peak started to rise around, November 26th. Let's say that, because that's really true. So November 26th, it started to rise, and then it peaked exactly on January 20th. So how many days are between that? Let's just say January 26th, even though that's quite a few days past the peak. So that'd be 60 days, right?
Mm-hmm.
Right? Right?
I think so, yeah.
Okay.
Yeah. No, I agree.
So we're geniuses.
Yeah.
So 60 days from January 21st would take us to what?
From January 21st?
Yeah.
Oh.
Yeah, because it took 60 days to
March.
get there if it's even. Right, yeah. So it'd be like, March 21st, it'll be about back
Towards
down to
March,
normal again. Now, and I'm talking about stone cold normal. Now, the peak itself, The big giant peak started around Christmas, so that was December 24th. And then, so that's a month. So a month from January 24th would be, February 24th. So by the end of the month, we'll be close to being done with the major part of the peak. But to get it stone cold back to where it was before that, it'll be another month. So, and if you look at the, and we may get canceled if I say this. Oh Lord, that Omicron doesn't appear to be as deadly as the others, because if you then switch to new deaths, you can see the peak for Delta and the peak for Omicron are almost identical, except the peak in cases for Omicron is 3 times the size. So anyway, so I think and somebody asked me today, well, are we just going to get another variant and another variant, another variant? It's going to be very difficult for a variant of SARS-CoV-2 to be more contagious than this one.
Right.
If you remember, the original OG COVID had an R naught of around 2.4. Delta was around 5 to 7, and this one is like 10. And it's getting close to measles numbers. Measles R sub-0 is 12. And if people are new, they don't know what we're talking about. Our audience is pretty sophisticated, so they know. But for people who don't know, the R naught is just the number of people that would be infected in a vulnerable population, idealized vulnerable population, by one person that has it. So the original one, about one person give it to 2.4 people, and then Delta, it was one person give it to 5 to 7, and then this one is like 10. Measles is 12. So and with each iteration, the number to get herd immunity increases too.
Right.
So if you remember the formula for herd immunity, it's 1 minus the quantity of 1 over the R naught. Okay. 1 over R naught. So for OG COVID at 2.4, it'd be 1 minus 1 over 2.4. It comes out to about 57%. You could hit herd immunity. And then when it's 5 to 7, it's going to be 1 over 5. So what would that be? That's 20.2. So it'd be 80% of people would have to be immune to hit herd immunity. And then when it's 10, it's 90%. Because it's 1 minus 1 over 10. So, it's that's why that number keeps marching, and people keep saying, well, they just keep ratcheting it up. Well, no, the virus kept ratcheting it up. I mean, there's some real horse shit has been told to us over this thing, but that one, I can't blame that on anybody but the virus. Yeah. So, all right. Okie doke. And that'll piss a bunch of people out, but what can I do? That's just the way it is. Them's the facts. But if you go there and look at this, it's very encouraging. These numbers, we are right close now today at February 15th, this is February 15th, the last numbers we got. We're recording this on the 16th. There was this simple moving average is 204. So the last time we saw that was on December 27th. Okay? So we're very close. And then at the peak of this, the simple moving average was 770,000 cases per day. And again, which shows cases don't matter. We shouldn't be paying attention to cases. The only thing that matters at this point is hospitalizations and death. And we are currently in our large health system discharging more people than we're admitting, and hopefully it'll keep up that way. If you keep doing that, then eventually you hit 0. So I would like to see 0. We're all sick of this shit.
Yeah. It's been a long time.
It has been. I'm effing fed up with it.
Yep.
Enough's enough.
It's been a long time.
Yeah. Well,
let's just hope it keeps going the way it's going now, which seems to be a little bit.
Yeah, let's get us back to June of 21 when we had almost no cases whatsoever. And let me see the last time we had 0 deaths. Well, we had on July 10th of 21, we had 86 deaths in the whole country, and that's the lowest it's been since this thing started. So we got to get back below that. All right. F COVID, sticking my neck out. Fuck COVID. Don't like it.
Don't like it.
I'm taking a big risk saying that. All right. You have anything for us today?
Well, I've got a couple good little articles.
Okay, because then I got to play a phone. We've got a bunch of phone calls to do. Go ahead.
We'll do the one that you sent, and I only read part of it. But
okay. Of course, you didn't read the whole thing. It's totally fine.
That's true. Wait, hell, you sent it to me this morning.
I know.
I was like, wait a minute, man. Now, if I can find a friggin' thing.
Oh, here we go. God.
All right, here we go. This is scientists have possibly cured HIV in a woman for the first time. That's how far I've made it.
That's how far you went? Okay, because that's not really.
I'm just telling you the truth, man. What it looks like though, in the past they've had 2 or 3 males that they've said they cured HIV in, and this apparently is the first case of what they've ultimately deemed a successful HIV cure, where they were using some therapeutic processes like stem cells. They start.
That's interesting.
They started with.
This was not antiretroviral therapy.
No. This is stem cell therapy, Dr. Steve, which is kind of cool because then I can help you with a little bit more stem cells, and joint, et cetera, et cetera. But
stem cells are pluripotential cells, which just means that they can have lots of different purposes. If you take a skin cell out of someone and you put it in and somehow grow it in a test tube, it will always be skin. Mm-hmm. But stem cells, if you can get the right ones, can be turned into heart cells or blood cells or tip of your nose cells.
Potentially brain cells. I've actually seen some research they were doing over in Germany for post-stroke victims.
Ooh.
And they were injecting stem cells into the affected area of the brain and actually seeing some regeneration of the brain cells.
Yeah, well, one thing we got to get to is being able to regenerate damaged spinal cords.
Yeah, shoot, yeah.
Because, a lot of people feel like when someone has a broken neck and they're now quadriplegic, that their spinal cord's actually been severed. I mean, that can happen, but for the most part, it's just been damaged. It's the swelling that happens afterward, and the spinal column is so constricted that if you have any swelling of the spinal cord or the tissues around it, it's got nowhere to go.
No, it goes in instead of out.
So it's going to go in instead of out.
It chokes off the spinal cord.
Yeah. So,
same thing with closed head injuries.
Sure. The head, the brain. Go ahead, talk about swelling of the brain. What it does in that enclosed space.
Well, that's what a lot of folks don't realize is that when there is a closed head injury, the swelling in the brain as their swelling starts to go out, it hits the skull.
Yep.
And the skull is rigid and hard, so it starts compressing in. That's what we start seeing changes to the brain anatomy and forcing the brain, trying to force the brain out of the bottom of the skull. And
that's right. There's one hole in the bottom of the skull called the foramen magnum, and if your brain starts to
herniate
through that's a real problem.
That's trouble, yeah. That's trouble. Yeah, but Dr. Steve, what the best I can tell is what the initial part of this treatment was. They were looking for better ways to treat HIV. That was a safer alternative, and what they're doing is using cord blood from babies, infants.
Yeah,
and
so
initially,
not fetal stem cells. Thank you.
No.
So we don't have that issue.
Oh God forbid. But anyway,
well, I mean, it's an issue.
It is an issue.
That prevents a lot of research going forward, or people from adopting stuff. There are people. I've got a couple on my team that if they test a vaccine on fetal stem cells or fetal cells at all, they just won't do it.
Yeah.
And even so what are you going to do? If you look? They got rid of thimerosal.
Yep.
Because people thought it caused autism. The vaccine companies and lots of researchers said it doesn't cause autism.
Right.
Doesn't cause it. It's not associated with it. There's absolutely no credible scientific evidence. But they took it out anyway because people were worried about it.
Yes.
Hell, I knew the science when we were giving my kids vaccines. I was like,
I remember.
A little bit of a twitch.
You were a little nervous.
Just a little bit, not enough to not do it. But
right.
It did enter my mind, and so they took the thimerosal out. Good.
Yeah.
Okay. Stop testing this stuff on fetal cells, and then you remove that objection to this stuff.
Yeah, don't need it.
There are other things. We have other models now that we can use.
Yeah.
So cord blood being one of those, you can donate that. You're not doing anything that people would feel would be immoral or anything like that, unethical or against their religion when you're donating cord blood because it's there anyway.
Yep. And then after that, there was a slight incubation period. I guess these things are pretty prolific, and then they actually add adult stem cells.
Okay.
Because for some reason those do a better job of whatever they're trying to do. And again, I wish I could be more.
Yeah, I wish you could read the article.
I had a challenge.
Are you even doing
I told you, man. I had a little issue this morning, but this afternoon.
But you had the diarrhea.
That'd have been less painful. But anyway, yeah. So, the great news is this is something certainly is reproducible.
Yeah.
In large scales, which is very important.
So I have somebody that's very close to me that's on antiretrovirals, and this person has a viral count that's undetectable, but they can't say that they are cured.
Right.
So having a treatment that you could do that would cure you of HIV would be amazing. I mean, we're curing hepatitis C all the time now. That was when I first went through medical school, hepatitis C was called non-A, non-B because they didn't know what the hell it was. They had no clue. They knew it was there, didn't know what it was. And then we had all these people coming in with chronic hepatitis C that were, eventually having some real issues with cirrhosis and other things like that. And now, heck, you go to a gastroenterologist and you've got a really good chance of being cured of hepatitis C. So death to all pathogenic viruses. Fuck that fucking viruses. God, I hate them. I hate them so bad. And so, death to them. Good. We now can kill hepatitis C. Good. We can kill HIV. Screw HIV. God. Asshole virus. And coronaviruses, you're next. Watch them come out. Watch the coronaviruses come after me because I said that.
I love it.
I found myself, and this is really morbid and gross, putting down all the music that I want at my funeral.
Oh, there you go.
Which we're not going to have a funeral. They're gonna cremate me, and then Tacey can do whatever she wants. But she will want to do something, and so she'll have a party or something. But I've got the soundtrack, and it's good. It's good. It's all upbeat stuff. It's like Neutral Milk Hotel, Airplane Over the Sea, and then a song that you and I are going to try to learn, which is the Flaming Lips, Do You Realize?
Cool. Looking forward to it.
So we got to do that one. And that's a very sort of death positive song, all of, and King Crimson Islands, because that's where I'll be, Your own island. Or whatever. Yeah. Or I'll just be gone, but people can pretend that that's where I am.
Yes.
And then I've got all there was every time we'd go on vacation, there'd be one song that would sort of define it. Oh, fuck, and I forgot one of them. One of them is MIA's song, All I Want. Have you heard that? I can't remember the name of it. All I want is, shit, and take your money. All I want is bang, 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 and take your money. You know
Oh,
that song?
yeah.
It's MIA. Anyway, I got to put that one on there because that was one of the summer songs. It's very random, the songs that end up on there, because one year, and look, don't think less of me, or do, I don't care. But one was Lord's Green Light. So, it just, you can't help what happens to be on the rotation and ends up on your Spotify alt music list. So anyway, so that's on there too. Go fuck yourself. And then a bunch of Krunben stuff from the last couple of summers, because that's been our poolside music for a long time. But anyway,
yeah, true.
Yep.
Hey, what you want a real quickie, or you want to save it for next time?
No, yes.
So the other one I found I was just starting to get into. And this is the perfect topic for you today.
Okay.
People with autism or ADHD are more likely to die early, review says.
Motherfucker, I'm doomed.
I was going to say, we're screwed. The ADHD thing is something you and I are both going to have to check with.
Yeah. Oh, my God. Well, I believe it.
Yeah, evidently it's just something about stress and high cortisol levels.
No, I'm stressed all the time. My job is killing me.
Calm, yes.
And I was supposed to step back from being the big boss as of October 1st, and my partner just said that, due to unforeseen circumstances, she might not be able to take over October 1st. And I was very encouraging. It's like, look, hey, we're here for whatever you want. But I'm like, oh my God, this is going to take another year off my life.
Yep. No, we're not going to do that.
Well, this is when we're doing this, right here, what we're doing, this is the only time I feel in control of my life. So anyway.
Until that phone starts ringing.
Yep. It's all right. Okay.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This episode is brought to you by Progressive Insurance. Do you ever find yourself playing the budgeting game? Well, with the Name Your Price tool from Progressive, you can find options that fit your budget and potentially lower your bills. Try it at Progressive.com. Progressive Casualty Insurance Company and Affiliates. Price and coverage match limited by state law. Not available in all states.
This episode is brought to you by Merrick Pet Care. For over 30 years, Merrick has crafted high-quality dog food. Since our founding in Hereford, Texas, we prioritized whole nutrition, with deboned meat, fish, or poultry as the #1 ingredient in every dry dog food recipe. That's why we say real is our recipe. Real ingredients and home-style flavors your pet loves, all to fuel more real time together. Look for Merrick online or in your local pet store.
This episode is brought to you by Indeed. We're driven by the search for better, but when it comes to hiring, the best way to search for a candidate isn't to search at all. Don't search, match with Indeed. Use Indeed for scheduling, screening, and messaging so you can connect with candidates faster. Listeners of this show will get a $75 sponsored job credit to get your jobs more visibility at Indeed.com/SBO. Terms and conditions apply.
Speaking of not being in control, let's take this phone call because this guy even said, well, you said you were going to play it last week and you didn't, but he just wanted to do a one-on-one. But listen, I appreciate what this guy is saying, and it's a very complicated situation, but here we go.
Hey, Dr. Steve, your pal Jim up in Massachusetts.
Hey, Jim.
Hey, gotta say, very disappointed that your friend Stacy now is back on the show again.
God damn it.
And what really bothers me most about it, Dr. Steve, is especially during COVID, you have emphasized over and over again, rightfully I might add, that everything about COVID should be based on facts.
Yes. Thank you.
Real data.
Yes.
And yet you allow him to come on and still...
Well, it was a fact. What he said was a fact.
Spew his nonsense.
Well, okay. Okay, let me let him finish this thing.
And really don't challenge him at all. Like you,
I don't agree with that.
No.
I did challenge him.
Yep.
And in the beginning, I was as shocked as anybody, and I'm not good with conflict.
No.
And he's been a friend of the show.
And he lives for conflict.
Yeah, he does.
That's the thing, is you and I are both laid back, passive. He's just like,
yeah, he loves
in
it.
your
He
face.
loves it. Yeah, he does. And he brings my wife cookies, and he brought us. Oh, I've got a bunch of boudin balls down there, by the way, from him. So
cool.
So he's a friend.
Yeah.
And when he said that shit, I was like, "What?" And I want to go back and play it again because I remember saying, "Listen, the biggest problem I have with this is that you're corrupting this medical professional." With all of this. And then he turns around and turns out, well, he was just trying to make some point, and it was all, it was a radio bit. But I don't remember not challenging him. I did let him kind of go on about it. Now, I don't remember him spewing any sort of scientific thing because that I would not tolerate. I mean, I would challenge any scientific stuff, but, I can't challenge what he did.
No.
For people who don't know, he came in with this story about how he gave somebody $100 to squirt the vaccine into a jar. And then we find out there's two people, probably more than that, in New York that made a couple $1 million doing
Two
that.
that have been caught.
Right, two that have been caught. And my point since then, because I caught a shitload of flack for this, and my point has always been that I wanted this out there because anyone that thought that, we have vaccine cards now, we can go to a Disturbed concert and we're going to be safe. Bullshit. No. Because there's do we have any idea how many of those fake vaccine cards? And Stacey will say, well, they're real cards. Okay, they're fake because they didn't get the vaccine. But I know what he means.
Yeah.
They're not counterfeit. They're actual cards that somebody put something on. But, to me, a real vaccine card means that you actually got the vaccine and they wrote down the lot number and stuff. How many did they do? Because certainly if they made a couple $1 million, it was enough to infect a shitload of people. And I don't like the idea of show me your papers, I don't want to go somewhere and they're saying show me your papers. I get it. Sometimes you got to show your driver's license or you got to buy a ticket, something like that. But beyond that, I'm not a fan of this idea that you have to have this piece of paper to be able to function in society. I mean, there are countries in this world where if you have a low social score, you can't ride on a bus, things like that. And I don't want to go down that road. I think that for me, again, I am vaccinated. I had it 3 times. I got COVID. I got the booster after I got COVID. So I'm a fan of vaccines, but I'm not a fan of forcing people to do something that they may not have. That they may not agree with, particularly when this thing is we have to all admit, was approved under an emergency utilization authorization. So these EUAs, that everything that's out there for COVID right now has not gone through the regular process. Do I think it's safe? Yeah, we've given how many billions of shots now. There have been some people that have had catastrophic issues, but the benefits so far have outweighed the risk significantly. But again, to force somebody to have a piece of paper, well, okay, so now you're Madison Square Gardens. We're going to open up, but you have to bring your vaccine card. And then how many real Stacey DeLoaches are showing up with that card that could, infect people?
Well,
and if you had the vaccine, what danger is that person to you, really? But, that's a whole other issue. Go ahead.
I just looked and found another one. Man facing federal charges for selling fraudulent COVID cards. He's sold like 800 of them already. 23-year-old dude. And he's facing federal charges, $100 a piece.
Well, he's an entrepreneur. So how many did he sell?
He was at 800 when he had posted.
So 80
this.
grand.
Yeah, and he had posted this, and of course the feds were like,
That's what Carl makes on Who Are These Podcasts every year.
Dang.
Yeah, he does pretty good.
That's pretty good.
But and he doesn't have to go to jail for it.
No, exactly. Yep.
He just gets Stuttering John mad at him. Oh, well, what are you going to do?
Yeah, what are you going to do?
Get by without making anybody mad. Okay, so I don't want to talk about this anymore. Oh, let me see if there's more to his call. Because I do feel like I challenged him, but I also felt that I shined the light on this process. At the time, I thought he was telling me the truth. And even if he isn't, it's still it's out there. So if you think you're going to be safe by making people show up with these pieces of paper, you got another thing coming. That was my main point.
To other people. So, in any case, very disappointed that he's on. I hope this doesn't become a regular thing.
Don't worry about it. He lives
because I think
6
you'll lose
states away.
listeners if he continues to be on there.
Will I? Okay. Well, maybe you're right. And I don't want to lose, dude, I don't want to lose you as a listener. I don't want to lose anybody as a listener. We've lost listeners because people friggin' died.
Yep.
Not
only listeners, but friends.
Okay. But we lost some because they didn't get the influenza vaccine.
Yeah.
So I am a fan of getting vaccinated for things, and I think that you should. And every year we talk about the influenza vaccine, and we can have Richard David Smith on here to talk about how he got turned around to being flu vaccine after being a flu vaccine type for the longest time, because he ended up on the ventilator, and he's got 2 kids and almost didn't make it. Thank God he's fine. And so he and his wife and his kids, his wife and his kids don't have to have that tragedy. But, Barry the Blade, who used to be on this show, by the way, I heard from his wife. And she wanted the shows that he was on because the kids now, Barry the Blade, for people who don't remember, he was a trucker, and he started a whole long narrative that we had on the show about trucker duty and about how, not DUTY, but, trucker feces, and how do you evacuate your bowels when you're an over-the-road trucker and you don't have time to pull over and stop, because it's a chore to pull those things over. Were you not? That might have been before your time.
No, I don't. I'm thinking.
And then we had.
Is he the one that got cancer?
No, Barry the Blade got swine flu.
Okay, no, I don't remember him.
Yeah. He got swine flu and unfortunately didn't make it. And it was very sad because we had a good relationship with him, and he would call in and we'd talk about how some people will take their Walmart bags and shit in those and then just throw them out the side. And he said, if you're ever on one of those road cleanup things and you see a Walmart bag on the side of the road, be very careful.
Hey, heads up, huh?
But anyway, yeah. So I'm definitely, every year we talk about that.
Oh, wow.
So, not anti-vaccine. I am anti-telling people what to do, but I'm also, I know we tell people you have to wear your seatbelt and you have to, have certain vaccinations to go to school and stuff like that. I get that. We have to have some allowance for the greater good. I do understand that as well. So it's very difficult, not an easy question. It's very nuanced. But anyway, I'm definitely not in favor of basing policy on things that aren't safe.
Yeah.
And the vaccine cards do not make us safe if you're using those as a litmus test to allow somebody admission to your venue. They're not going to make you safe because there are too many fake ones out there. So that's what I don't like. That I really don't like. We could even talk about mandates and stuff like that. It's we do mandate certain things, but we mandate that people wear their seatbelts, but you don't have to wear your seatbelt. Right. You don't have to wear it. It's just if they pull you over and you're not wearing it, they can heap that onto your speeding charge, right?
That's correct.
That's what they use it for.
That's correct. Yep.
Anyway, all right. But do wear your seatbelt.
Yes, please.
If you get thrown from your car, you got a 50% chance of dying. If you wear your seatbelt and you have that same wreck, you're significantly less likely to die. And the chances of you being trapped in your car so that you can't get out are about 1 in a million. So you're looking at 1 in a million versus 50%. Wear your seatbelts.
Yep.
All right. Okay, dope.
Hey, Dr. Steve. My son, number 2, has had...
Is that his name?
Like,
Number 2.
You named your kid after bowel movement? It's my son.
I love it.
Number 2.
...in his thumbnails.
Oh, okay. Well, wait a minute. Okay, I don't want to mess.
Rewind that. Yeah,
okay. I'm sorry. I shouldn't be making fun of your kid. I'm sorry. I wasn't making fun of the kid. I was making fun of you naming your kid. Anyway, don't worry about it. I'll give myself one of these. No. Okay. All right.
My son number 2 has had these, like, dimples in his thumbnails since he was born, I think.
Okay.
But now he's, 10, and they're very noticeable. It's like his thumbnails just ripple, and he's getting a little self-conscious about it.
Yep.
What the hell is it, and how do you fix it?
So he was born with this. So he had a congenital dysmorphia of the nail. Dysmorphia just means weird shaped. Use that in a sentence. Dr. Scott's head is dysmorphic.
Dysmorphic, yes.
Very strangely shaped. So this, I texted this person back. I said, Google chevron nails. This would be a good one for you to do, Dr. Scott.
Sure.
Or herringbone nails. And those are congenital, just ripples, and they usually meet in the center, sort of like a herringbone.
Mm-hmm.
And that goes away usually right after puberty or in early adulthood. And he said, no, that's not it. It's just one. And I said, well, then I know what it is. It's koilonychia, Koilonychia, a.k.a. spoon nails. And these are nails that look scooped out. The depression is usually large enough that you could put water in it or something and hold it in there. And there's sometimes a sign of iron deficiency anemia, but when a kid has them, sometimes they just have it. And then when they get just pre-pubertal, late childhood, they'll usually go away because the nail bed will just naturally thicken as they get older. So anyway, all right. So that's probably what that is. And he looked at the picture, said, yep, that's absolutely what it is, and he was happy that why didn't the pediatrician say something? Why am I telling him this?
I don't know. This late in the game, you would have
He's
thought.
10.
Yeah,
He's been to the pediatrician
at least once.
Yeah, at least 10 times.
At least.
Goodness gracious. Anyway. All right. We had somebody call before, and what it was they had a prostate biopsy and then they were bleeding afterward. Okay. And we said either they've got some swelling of the prostate or it's just flushing out what it had. But either way, go back and get checked because that's not, when you have blood coming out of an orifice and the urethral meatus.
Well, was it rectally where he had his prostate?
No, it was coming out of he was peeing blood.
Oh, he's peeing blood. Okay, yeah. I'm sorry I didn't hear that part.
That's okay. That's right.
I was going to say because if prostate biopsy could be out of his rectum.
Yeah, no, that's right.
Yeah.
We have a friend who calls into the show sounding like an old country woman who had a prostate biopsy and he got septic after that because they went through his rectum and got a few naughty bacteria into his prostate, and it ended up infecting his bloodstream. It's very unusual, but not unheard of. So anyway, so let's listen to what this person has to say.
Hey, Dr. Steve, it's Albert from Albuquerque. How you doing?
Hey, good, man. How are you?
Great.
Good.
Hey, listen, not so much a question, but a follow-up from a previous call. I had a prostate biopsy, and I called in about the additional blood in the urine after that, the interesting notations on that. But the update now is the biopsy came back positive. My Gleason scores are of such a type that it's not super aggressive, but aggressive enough to treat. So we're going to get a prostatectomy here
at
the end of March and get it taken care of and get it taken out.
Okay, good.
Interesting thing here, and one of the things I was concerned about is the long-term effects of prostatectomy and some of the side effects related to urinary control. And the surgeon I'm working with has a method where he goes in through with the suprapubis catheter directly into the bladder to alleviate some of the trauma to the urethra that you'd usually have with a catheter for a couple of weeks after the procedure. So I thought that was kind of interesting, kind of different aspect to that. This guy is very well known in the field, I guess, and he's got a great success ratio for quick turnaround for full function post-prostatectomy.
Good.
Anyways, like I said, no real question other than just a statement to say to all your listeners, my prostate was not abnormal in size. My PSA was not that awful high.
Yeah.
However, I have a Gleason score that shows that something needs to be done. So get your shit checked out.
Yep.
There you
Take
go.
care, Doc.
Okay, man. And keep us in the loop and let us know how things are going. So I'm glad he got that checked out. So the Gleason score, this is a system that they use to classify what the prostate tissue looks like under the microscope. So when they get a biopsy, they'll look at it, and they're looking at the glandular architecture of this tumor itself. So they will look at what is the predominant pattern, and then what's the second most predominant pattern. And each one of these are given a grade between 1 and 5, and then the Gleason score is the sum of those two grades. That's just basically it. And 5 being closer to malignancy and 1 being less likely to be malignancy. And so that's what he's talking about. So he didn't have one that looked horrifying, but he had one that showed that they need to do more. So he's going to have a suprapubic prostatectomy. And that's an interesting one, because instead of going, as he said, through the penis and up the urethra to get this thing, which my great uncle, I had some hand in inventing that.
Oh wow!
Yeah, he was he was a sadist, obviously. But this one, they, instead of going up through the penis, they do a surgery through an incision in your lower abdomen above that pubic bone. So if you feel just above your the jungle area, and then right above that you can feel a bone, you know, and that right above your in women it's, you know, well, you know where it is anyway. You've felt it. And then they go above that, and they make the incision through there, dissect through to the bladder, and then the center of the prostate gland is removed right there. So. And that part of the prostate gland that's right there is called the transition zone. And it'll be done in the hospital, and they may have to stay for a while. And, you know, it's less likely to cause trauma to the urethra, obviously, because you're not going through the urethra. There are some other nerves that can be involved. And so I told him, ask him 2 questions. What's your success rate for continence? That's number 1. Oh, number 2, I forgot to tell you this one, dude. What's the success rate for getting it all the cancer that you need to get using this procedure? And then the third is maybe the most important. What's your success rate for retaining sexual function?
Good questions.
So if you just ask them those 3 things.
Yeah.
So the procedure itself is pretty safe. There's some chance you could get infected or something like that, and there's anesthesia involved, so there's that. But really, this is a pretty well-tolerated procedure. And your recovery time in the hospital is usually about a day, but it could be up to 7 days, depending on how things go. And if you weigh 600 pounds and you have obstructive sleep apnea or Pickwickian syndrome or something like that, then you're going to be in the hospital longer. All right. And then it might take 2 to 4 weeks to recover after that. So just take it easy. If they tell you 2 to 4 weeks, take as much time as you can get. And you're going to feel better pretty quickly, but if you start getting cocky and doing stuff that you shouldn't be doing,
don't do crazy stuff.
Be a problem.
Yeah.
All right. Okay, doke. All right. And yeah, you're going to have a catheter for a little while. Okay. Well, hello.
Hey, Dr. Steve. This is David in Franklin, Tennessee.
Hey, David.
Hey.
I have been kind of...
Hey, Franklin, Tennessee is
where Franklin, man.
That's where Tweaked Audio is.
And I've got a bunch of family and friends.
Do you?
There, sure.
Yeah,
good stuff.
Yeah, if you go through Franklin, go to Tweaked Audio and tell them Dr. Steve sent you. Use offer code FLUID.
Yep. Right. Gang, listening to all your recent shows just because of weekend work, and I was wondering, why are the older monoclonals that were designed for the previous variant or variants, why are those now totally ineffective while
it's crazy.
Vaccines that were designed to tell your body to create the spike from the alpha, why would that still work?
Such a great question.
Why would one work and the other not work? I hope that question makes sense.
Yeah, absolutely it does. Do you want to take a shot at it before I hit it? Because I know why.
I'd say go for it, yeah.
Okay.
Yeah. I was talking on YouTube here.
Oh, okay.
Sorry.
Jesus. Not paying attention. You're like Tacey. At least you're doing something to the show related. Tacey will just be over there flipping through Facebook.
No, I know.
She gets so bored with me talking. She's heard my voice for 20 years. So, this is a great question. Can you imagine that if you're Regeneron and you've got this monoclonal antibody cocktail that you've come up with and it works so great, and then overnight it's worthless, and you're just producing the shit out of it. You got factories producing this stuff. Overnight it's done. Now the vaccine obviously not as effective for preventing infections with this new variant, but still pretty damn effective for keeping people out of the hospital. So why is that one works and the other one doesn't? Well, the reason is when you give someone the mRNA vaccine, they are making the whole spike protein. They don't just make one antibody to that. The body is amazing. It'll take this group of molecules and say, "Well, I don't like the way that looks," and it'll make antibodies to that. Then this other group over here on the other side, and it will make several different antibodies. Matter of fact, the original, RegenCov was 2 different antibodies. So that's the problem, is when this thing mutates to where your antibody doesn't work, the body's antibodies may still be doing their thing.
Wow.
Because there's more of them, more different ones. So Sotrovimab is one of the antibodies for COVID, and it still works. Works great. But, RegenCov and the other one from Eli Lilly, not so much anymore.
Yes.
All right.
So Colin's got a great question here, and it's referring to treatment or suggestions for treatment for recurring Epstein-Barr virus, chronic fatigue syndrome, and other similar vague and hard to diagnose autoimmune type illnesses. So.
And you're in contact with...
Yeah, right here. Yep.
He's on there now. Okay, so the first question is, so Epstein-Barr virus is it's a herpes virus, human herpes virus 4. It is a member of the herpes virus family, along with herpes simplex 1 and 2 and varicella, which causes chickenpox and also shingles. Most people get it at some point in their lives, and it causes infectious mononucleosis.
Gotcha.
That's the syndrome that it causes. There are also other things that it can cause as well. There's some tumors. There is a tumor that's associated with Epstein-Barr, but let's just talk about infectious mono. So mono causes severe sore throat, but fatigue. And I was out of school for a month with mono when I had it when I was a kid. You get swollen lymph nodes in the neck. You can get an enlarged spleen from that, so they tell kids don't do contact sports after you've had mono for at least a month. Your liver can enlarge and all that stuff. And it's really easy to spread through body fluids and all that kind of stuff. Now, when it comes to recurrent Epstein-Barr, any of these episodic viruses can cause chronic infections. Rarely. So I'm going to look this up and see what the current thinking on chronic Epstein-Barr is.
Can I talk for a minute?
Yes,
about
of course.
Our approach. Yeah, I'll do our approach while you're looking at it. So, Colin, I will tell you from specifically what I do, which is the traditional Chinese medicine. We use a lot of old Chinese herbal medicines to help with fatigue and with the virus, and also the acupuncture. Believe it or not. I know for a fact I've seen it. I actually got a guy referred to me. He had been to the Mayo Clinic, and they suggested that he continue with his acupuncture treatments and his herbal medicines.
Yeah,
because it was providing some symptomatic relief.
Yeah.
So because the Western medicine just didn't have a great treatment protocol.
No, we don't. We don't.
We do have.
This is when we
things.
send people to Dr. Scott. Yep. It's when we suck at things, and this is one we do. Rare people who become infected with Epstein-Barr virus or can reactivate it, develop a disease that doesn't resolve, and they can get fulminant infectious mononucleosis, and then those people don't do well. They're in the intensive care unit. And then other people have a more chronic course with sort of a persistent or intermittent sort of mono-like syndrome. And it could be fever, fatigue, swollen lymph glands, stuff like that. And those people are unable to control their EBV infection. And they'll get infiltration of tissues with Epstein-Barr virus infected T cells and natural killer cells and other white blood cells. So they're actually infecting their white blood cells, and that causes problems. So these people may have a problem with their immune system in that their T cell activity or their natural killer cell activity has been degraded by this. So for those people that have that, I would see a virologist for that.
For sure. Yeah.
And these are people who, and it's usually going to be at a medical school or some research center where people go from infectious disease specialty and then specialize in viruses.
Right.
And let's look real quick.
And may I say, while you're looking, I can tell Colin just if Colin would like to send us an email, I can maybe find someone that can help him.
Well, we would need his email and his
address, or area,
his zip code.
Yeah, area.
Let's look up Epstein-Barr and chronic. Well, let me just put Epstein-Barr and then other terms, chronic. And let's just do that, and then we'll search. And I'm at clinicaltrials.gov. So here you go, genetic studies of chronic active Epstein-Barr disease. And this is currently recruiting in Bethesda, Maryland. So that might be a place where they're already very interested in that. Colin, I'm just going to recommend that you go to clinicaltrials.gov and then put in the term Epstein-Barr to the disease and then put in chronic to the modifier. Okay. And I've got 169 freaking studies. So some of them are completed, so you want ones that are recruiting. But here's one, chronic fatigue following acute Epstein-Barr. Okay, that's Epstein-Barr. Treating severe chronic Epstein-Barr virus with EBV-specific cytotoxic T lymphocytes. So this is one that was at Texas Children's and Methodist Hospital in Houston, Texas. What they were doing was taking T lymphocytes and stimulating them to kill Epstein-Barr virus and just go in and just friggin', multiply and kill it.
Right.
Let's see. Here, Epstein-Barr virus is a possible cause of chronic fatigue syndrome. That's University of Mississippi. So there's stuff out there. Now, here I'm looking for a treatment one. Here we go. Valganciclovir. Okay, it's Valcyte for chronic fatigue syndrome patients who have elevated antibody titers against human herpes virus 6 and Epstein-Barr virus, which we now know is human herpes virus. What? What number is it? Anybody listening? Scott?
17.
God, you... 4.
Dang it.
Okay.
Close.
So if someone said, well, I have herpes simplex 4, you just say, well, what, you have Epstein-Barr?
Epstein-Barr, yep.
So there's some hope out there, and valganciclovir is related to valacyclovir, which is Valtrex, which we use for herpes and chickenpox. So that would be an interesting one to see if anyone is treating people with valacyclovir already. Let's look, cyclovir and Epstein-Barr. Here we go. It says infected B cells, but not the number of Epstein-Barr DNA copies. Okay, that's not. Okay, here we go. A 6-month trial of Valtrex in Epstein-Barr virus subset of chronic fatigue syndrome. Improvement in left ventricular function. So they picked a really weird endpoint.
Yeah.
They picked a weird endpoint. Let's see if their secondary endpoint had anything to do with fatigue, because that's what Colin is calling about.
Yep.
It says concluded that the 16 chronic fatigue syndrome patients included in both phases with EBV persistent infection, so they got to prove that first, Colin, are improved after 6 months of continuous pharmacokinetic dosing with valcyclovir. And let's see how much they gave them. Well, I'll tell you what, Colin, just email us. We'll email you some of this stuff.
Let's do it. Yeah.
But, it's a real thing as long as the Epstein-Barr is detected in your system.
Yeah.
And if it isn't, then there are other things that can cause chronic fatigue syndrome. One of those being low testosterone.
Low testosterone, sleep apnea. There's anemia.
There you go. What's the other one?
Anemia.
Yeah, what's the other one? You said that already.
Oh, sleep apnea?
Yeah, you said that already.
Low T?
Yes, we said that already.
Oh, what else?
My God.
Old age?
Okay, I'll give you one.
Give yourself a bill.
That's it. I'm not answering anymore.
Thyroid, hypothyroid.
Oh, thyroid. Yeah, I'm sorry.
Okay.
Hypothyroid.
Jesus.
Yeah, sorry.
All right. Good. Excellent question. You got any other ones
4
in
out
there?
of 5. That's better than my most about that. Yeah, last one real quick.
Colin, if you don't know our email address, go to. I'll put it in the chat room. It's fine, but you can just go to our website at drsteve.com and click contact. Ignore the warnings. It'll say don't ask medical questions. That's not for you. Okay, you can. It's like you're a hot girl at a nightclub in New York. You can just go right in.
All right. And Game Junkie wants to know about hypogammaglobulinemia.
Okay. Well, okay.
Yeah,
It means
how about a simple one?
Means you have low gamma globulin. I mean, what do you want to know about it?
Yeah.
Okay, so people with hypogammaglobulinemia have low levels of antibodies, basically. I mean, that's what gamma globulin is immunoglobulin G, which is IgG, which is a collection of antibodies. And so when you're looking at gamma globulins in the bloodstream, you're looking at all the collective antibodies against everything that's floating around in your system. And there's a standard level of those things that people who are felt to be normal have, and people who don't have that have low levels, and they're called hypogammaglobulinemia. You can have other deficiencies of other types of antibodies like IgA, but IgA is the antibody that is secreted in the mucous membranes. Mothers have it when they're breastfeeding. For example, they'll transmit antibodies to the child, which is why you get the nutrition from formula, but you get more than just nutrition from breast milk. Mm-hmm. So even if you can only breastfeed for 6 weeks, it's the kid. I mean, my youngest, who was causing the Alexa to go on and off, the Ring doorbell, in and out.
You're number 2. My
number 2, right? I'm going to call him number 2 from now on. Hey, number 2, and you know what I mean, wink, wink. He is alive today because my wife was breastfeeding. I've told this story before, but for those who haven't heard it, he was 3 to 5 days old, and I walk in the room, and you could feel the heat coming off of him.
Oh, yeah, I remember.
And he had a fever of 105. We took him to the hospital, and he had respiratory syncytial virus. And they were like, when we see him this age with this severe of an infection, we're concerned that they're not going to make it. And if they do, they're going to have horrible, horrible lung disease going forward. And I'm a MD, and I treated kids before. I was kind of freaking out. And the way it works in our thing is Tacey freaks out up front, and then I'm stolid. Mm-hmm. And then I freak out later, and then she's kind of got her second wind. So we make a good couple in that regard. So there's always somebody around that's got their shit together. And even if we don't both have it together at the same time. But so we were kind of freaking out, but he just sailed right through. And the reason was she gave him the RSV because she had it. She'd been sick for about a week before she gave birth to Beck, and so she gave it to him. But she also gave him the antibodies that she had developed as the cure, and so he continued to get IgA antibodies against RSV and just sailed right through. No, they couldn't believe it. They didn't tell us some of this stuff until after it was over. They were like, "We were really freaking out when you brought him in here."
Oh yeah.
So anyway, so that's IgA. So signs and symptoms of people with hypogammaglobulinemia, it can be just slightly low, and they may be totally asymptomatic, have no symptoms whatsoever. The ones with the more severe version of it usually present with a history of recurrent infection. They're like, I'm sick all the time. Mm-hmm. Every time somebody gets them, I get it. And I get it worse than everybody else.
Low immune system. Yeah.
And so, they'll diagnose it by drawing blood. And they'll usually, where if you have slightly low immunoglobulins where you're producing intact antibodies, they'll just watch you. And babies that have it may have complete resolution without doing anything. They just kind of grow out of it. And then some people will have low immunoglobulins, and they're still able to produce antibodies. They don't require anything either. Mm-hmm. So there is replacement therapy for people who don't fit into those that need it, and it's just intravenous immunoglobulins that they give it to you, like I said, in the infusion center intravenously. All right?
Mm-hmm.
All right. And then there's a bunch of different subtypes. There's like X-linked A-gamma globulinemia. Those people don't produce any. That's called Bruton's disease or some other stuff like that. Anything else you got out there?
That'll be it.
All right, that it? You want to do, let me see if I've got anything here. We did those.
That was a globulin for Halloween, Rick. That's pretty good.
That is pretty good.
That's pretty good.
All right. Look at the structure of antibodies. They're interesting. They're Y-shaped. And they have sort of a common stem, and then the Y things differentiate. And the very tip of it is where all the business is done. And it's fascinating. Just look at that. I wish we did a TV show. We could show things like that.
Mm-hmm.
Anyway. All right. Well, I think we've done it for today. Thanks always go to Dr. Scott. We can't forget Rob Sprance, Bob Kelly, Greg Hughes. Who else, Dr. Scott? Anthony Cumia, Jim Norton, Travis Teff, That Gould Girl, Lewis Johnson, Paul Ovcharski, Chowdy 1008, Amanda Swan, Eric Nagel, the Port Charlotte Whore, the Saratoga Skank, the Florida Floozy, Roland Campos, Sister of Chris, Sam Roberts, John Field, She Who Owns Pigs and Snakes, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Watkins, Double Steve Tucci, Amy from Kentucky, the great Rob Bartlett, Vic's Nether Fluids, Cardiff Electric, Casey's Wet T-Shirt, Carl's Deviated Septum, Jen from the Jingles Department, producer Chris, Croge, the inimitable Vincent Paulino, everybody. Eric Zane, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, and of course our dear departed friend, Fez Watley and GVAC, who supported this show, has never gone unappreciated. We will always miss them. Go to our SiriusXM show on the Faction Talk channel. SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to you, our listeners, whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, Scott.
All right.
You got time to play some music?
Hey, man, let's do it.
Let's do it. What we got to do?